am Karen Sheffield Abdullah, and I am a researcher who explores stress and anxiety in Black women. I am a nurse midwife and been a nurse midwife of 17 years. I am a mindfulness instructor, and I'm an assistant professor at UNC Chapel Hill School of Nursing. It's my pleasure to talk to you today about a critically important topic, in particular for our community, surrounding stress and all the competing demands that we have on our time, work stress, family stress, stress that's just happening in the world. Many of us take on different roles within our families. And when we think about stress, we need to also recognize that there are stress-related health conditions that really affect Black women. And those conditions are diabetes, high blood pressure, stroke, and complications from cardiovascular disease. And so we want to take a moment to really think about what are ways in which we can manage our stress to decrease our chances of having those risks related to those chronic conditions. When I say the word stress, think about the ways in which stress can manifest in our bodies. Where do you feel it? Many will say that they feel it in their head, with headaches. They have difficulty sleeping or insomnia. They feel anxious. Their heart races. Their hands get clammy. Their stomach feels funny or uneasy. And so when that is happening, I'd like to offer you an alternative to how we might manage our stress. And that involves something called mindfulness. What we know is that mindfulness has been useful in decreasing many of the physical issues that we can have, as well as our emotional health. It has been associated with decreased anxiety symptoms, decreased depressive symptoms, increased quality of life, increased well-being, and also thinking about our heart health as we slow down and really engage in the moment. That is what mindfulness is about. Oftentimes the mind is worrying about the future or ruminating about the past. What I'm inviting you to do is stay present in this moment. With mindfulness, specifically mindfulness-based stress reduction developed by Jon Kabat-Zinn over 40 years ago, the definition of mindfulness is present moment awareness, on purpose, paying attention to whatever is arising in that moment. And we do that without judgment. There are many different mindfulness practices that we can engage in, but today I'd like to invite you to think about taking a moment with me to engage in something called just a sitting meditation for just the next few moments. So inviting you now to get into a comfortable position for you that best supports alert awareness. Mindfulness is not about religion. It's not even necessarily about spirituality. It's not about being a quick fix or a magic bullet. Mindfulness is really about bringing your mind, slowing things down. You can achieve calm, but it's really about being in the present moment. And so now that you've gotten in your comfortable position, inviting you to close your eyes, if that feels comfortable for you. If you would prefer not to close your eyes, just adopting a gentle downward gaze, perhaps looking at 5 or 6 feet ahead of you, at nothing in particular. So let's take a moment to just fully arrive to this moment, a moment you will not experience again. And notice the breath. No need to alter or change it, just noticing what's here, what's calling your attention, noticing any areas of unease or dis-ease or tension, inviting you to bring a softening to those areas. Noticing what's the mind doing? If you notice that your mind is wandering, as the mind does, just gently bringing it back to this moment. No judgment, with kindness and curiosity. Noticing the felt sense of your body sitting on your chair. Perhaps noticing your feet grounded on the floor. If you're noticing any tension in the shoulders, bringing a softening. Softening to the brow, to the jaw. What is calling your attention in this moment? And as we end this meditation, just inviting you to set the intention for your day. What is the intention? Perhaps it's for peace, clarity, discernment. But whatever it may be, setting that intention now. In the next moment, you'll hear the sound of the bell. I invite you to listen to all the way through the sound of the bell, so you can no longer hear it. And when you can no longer hear it in your own time and at your own pace, opening your eyes. So it's been a pleasure talking to you today. And from my heart to yours, I extend this loving kindness. May you be well. May you be at ease. May you have peace. May you experience joy. And may you be healthy.